Hi everybody. My name is Jillian Schultz. I'm the program director for the Parkinson Association of the Carolinas, and I'm happy to have you here for our virtual support group. This month is actually a reschedule of a meeting that we were originally supposed to have a few months ago, but had to be postponed. And I'm very excited for our presentation today about atypical Parkinsonisms. We have Courtney Malberg here, who is the Associate Director of Education from Cure PSP, and she's going to go ahead and share more information about what alternative or um, Parkinsonisms are and who Cure PSP is and resources and things that are out there. So welcome, Courtney, and I'll pass it over to you.
Great, thanks so much. I will share my screen. Okay, can we see the slides? Okay. Okay, great. I saw it on. Thank you. So yes, as Jillian said, my name is Courtney. I'm the Associate Director of Education at Cure PSP. I've been here for almost 2 years, coming from a time in the Parkinson's field. So at the Parkinson's Foundation in an educational capacity as well. So kind of followed what is the typical diagnostic journey of PSP, starting in Parkinson's and then kind of moving towards. And so here. Today, just some overview of what I'll be talking about is first and foremost, recognizing the difference between Parkinson's disease and atypical Parkinsonian syndromes or atypical Parkinsonisms. After that, we'll talk about the unique care needs for people with PSP, CBD, and MSA. There's different treatments available for these diseases versus Parkinson's, so we'll get into that. And then we'll learn more about Cure PSP resources and programs, and then I believe it sounds like there's like going to be about 15 minutes if I stay on track for questions. And so feel free to save those to the end or send them in the chat and I'll try to address them. I'm also totally fine if you want to stop me and talk about something that's on the screen. So yes, this is pretty casual.
Since you're doing that, I'm going to take this into the kitchen. We'll take this into the kitchen.
So a little bit about Cure PSP as a background is that we are an organization of freshly 20 people. When I started a little over under 2 years ago, we were 15. So we're growing pretty quickly, which is really exciting. We raise awareness, build community, and improve care, and hopefully we'll find a cure someday for progressive supranuclear palsy, PSP, cortical basal degeneration. You'll also hear it called syndrome, so CBD or CBS, and then multiple system atrophy. To break those down a little bit, because that's kind of intense, I'm going to skip ahead and explain that this is the umbrella of Parkinsonism. And so what Parkinsonism is this umbrella term for these four symptoms, which I'm sure you're familiar with, whether you're someone with Parkinson's or you care for someone with Parkinson's or you take care of people with Parkinson's. And the way it works is that under this umbrella of Parkinsonism is Parkinson's disease, and then atypical Parkinsonism, so PSP, CBD, and MSA. Others are featured. I just didn't list them for the purposes of this presentation. So back to Cure PSP. We operate off of 3 pillars, and you'll hear more about the programs and resources under each of the pillars at the end of the presentation. But the first one is what we call care. And so that's really focusing on the person with a diagnosis and their loved ones, including their care partners. So that looks like enhancing delivery of care, support groups, direct programmatic supports, and educational materials. Consciousness is raising awareness of the diagnosis. We actually have a very strong advocacy arm, and they are working pretty strongly to help, federal government be aware of us and kind of think of us when we're talking about Parkinson's and things like the National Plan to End Parkinson's Act. And then consciousness also includes educating healthcare professionals. These diagnoses are very rare, which we'll talk about. And so it's important for healthcare professionals to know what they are and know how they differ from Parkinson's. And then lastly, cure. We hope someday to have a cure, but for now we're working on a lot of research for diagnostic tests and biomarkers. There currently is no treatment for these diagnoses in the same way there is with Parkinson's. And so a lot of our research supports trials and student research finding a cure and treatment. Okay, so that's about Cure PSP. Feel free to chat any questions. Oh, I see a chat. Let's see. Oh, that was just saying put questions in the chat. Thank you. Okay, great. So we're going to dive in. After that super quick overview, I'm curious how familiar people are with these diagnoses, and feel free to type that in the chat 1 being, I've never heard of these. What are you saying to me? And then 5 being like, yep, people are in my support groups. I see this, I have this, etc. So feel free to type that into a chat, say it out loud, whatever you prefer. Okay, let's see. Oh, thank you. Keep going. Love to know. Just kind of informs the rest of what I'm going to say. So far we have 1 to 3. Okay, 2, 2, 3. Okay, super helpful. You can keep sending that, but that's great context. Thank you all for sending that. So like I was saying, we have the umbrella. We're cousins with Parkinson's disease. And so oftentimes people are initially diagnosed with Parkinson's because they go to a neurologist with these 4 presenting symptoms. And so a neurologist says, we think you have Parkinson's. Let's try you on carbidopa-levodopa. And so they get on these medications, maybe they don't work and things are kind of progressing and it's kind of unclear what's going on. And so these are the 4 kind of flags that maybe we're not dealing with Parkinson's disease. And so I think this is important for people to know when they see it in their community. So the Parkinson's community is so strong and vast, and I think it's just helpful to know, maybe not even for yourself, but just, noticing things in others and being able to be empathetic to the situation they're in. So the 4 flags, 1, super early postural instability, and then that leads to falls. So falls are a part of Parkinson's disease, but in PSP, CBD, and MSA, it happens much earlier in the diagnosis than you'd expect. The second one goes with that. It's a much faster much faster progression than expected. So not only is that things like balance and movement, but things like speech, swallowing. In PSP, there's a lot of ocular visual symptoms, which we'll get into. The third is early dysphagia, so that's swallowing issues. So once again, they're experiencing issues with swallowing and safety and maybe inhaling particles much earlier than you'd expect into onset. And then lastly, this is kind of the main flag, I think, is there's poor or little response to levodopa. And so that is can be pretty devastating for folks when there's this treatment that's given to them, tells them, Brenna, you can put your question in the chat. I just saw that, sorry. There's a treatment's not working in the way that it does for others. And if you're in a support group, then you notice, so that works for her, that works for him, but why isn't it working for me? So these are just the 4 general flags of PSP, CBD, and MSA, might not be PD. And you'll see by this little computer icon down in the bottom, this is really for healthcare professionals. To the point I made earlier, it's important that healthcare professionals know the difference so they can diagnose people sooner to get them better care. So this is, it's a mouthful, but it's a nice little document that that you can send to doctors, ask to be put on your EMR, whatever is necessary for you or the way you prefer, and doctors can scroll through it and kind of see the differences between these 3 diagnoses, Parkinson's disease, and also dementia with Lewy bodies, which is a different kind of atypical Parkinsonism. Okay, any questions so far before I dive into the individual diseases themselves? Okay, cool. Okay, so feel free to ask questions. We can get as in-depth as you want. I'm going to try to do a little bit of an overview, not get too intense. But like I said, if you want, feel free. We can ask questions and chat more about them. I laid out kind of general differences between Parkinson's and PSP and CBD and MSA here. And so we'll just go through one by one. And so the first one is PSP, progressive supranuclear palsy. What's different from PSP from not only Parkinson's, but the other 2 diagnoses is that people with PSP fall backwards. So this is something that's really interesting and very specific to PSP. In Parkinson's, people tend to fall forwards. And of course, if you have a fall that is backwards due to, the way that you were moving, that doesn't mean you have PSP, but people with PSP almost continually fall backwards when they fall rather than forwards. And so because of that, people have to be careful with things like walkers because they need a walker that can hold them forwards rather than preventing them from falling backwards. So a lot of times occupational therapists will recommend a sandbag on the walker or a weighted walker so that it can help prevent them from falling backwards and it can keep them stable, leaning forwards. Rocket sign is actually tied to impulsivity, which is a symptom of PSP, which is in the cognition section as well. And that's when people with PSP kind of jump up from their seat as if they didn't have, the motor impairments, as if they weren't kind of processing the fact that they should be getting up slower, and that can cause falls as well. So I mentioned that these diseases have a little bit of oculovisual, which means just problems with the eyes. And so that's another big differentiation from Parkinson's disease. And the hallmark feature of PSP is actually called gaze palsy, which is when there's difficulty moving the eyes side to side and or up and down. And so that looks kind of just like an inability to kind of track objects, read, and follow along with moving things. In addition, there's this fancy word right here called blepharospasm, which is a really fancy word for spasm of the eyelids. And so that can look like inability to shut the eyes, inability to open the eyes. It can be kind of jerky movements of the eyes. And it's not necessarily physically uncomfortable, but it makes seeing difficult and can be very stressful for folks. Lastly, cognition, which is impulsivity and apathy. There's a little bit of executive dysfunction. There's no dementia with these diagnoses per se. So impulsivity can look like the rocket sign, where people aren't taking into consideration their physical abilities. And in some people, it can look like things like shopping, gambling, those types of impulsivity. Apathy is really, really common in people, which differentiates from depression. And so that can often be kind of difficult to see the difference of. And so a neuropsychologist or neurocognitive behavior science neurologist, I said that all wrong, but basically it can sometimes be helpful to see a neuropsychologist is what I was trying to say, or a cognitive behavioral therapist to kind of help differentiate the apathy and how we can treat that. And so you'll see down in the red that 6 to 10 individuals per 100,000 have PSP, although we consider that an underestimate because it is so difficult to diagnose these diagnoses. Secondly, we have corticobasal degeneration. And like I said, you'll sometimes see that labeled as CBS, which is syndrome. That's a whole ballgame, but know that they're the same thing. They refer to the same thing. It's becoming more commonly used CBSs. And so you'll see both. And we like to say both at Cure PSP just because we never want to confuse people if they got a diagnosis of one or the other. And so, yeah, you'll see them both. Unique features of CBD are one, it is always asymmetric at first. So that can happen in Parkinson's a little bit, but CBD is very much started on one side of the body. So you'll see, maybe typical Parkinsonian symptoms, but they'll only be on the left or the right side. For some people, they eventually progress to the other side, but the original side that started with the symptoms almost always maintains stronger symptoms. A second one is called alien limb syndrome. What that typically looks like is like a lifting of a limb without the intentionality of it. And in fact, upon moving it down, it still lifts. And so for most times it's arms and hands. It can also be legs, and it can just be like involuntary movements, but for the most part it's arms. And there are occupational therapists have some kind of made from scratch ways to manage that, like weights and things like that you can put on your arm. But again, it's not uncomfortable. It's just kind of I think a lot of people when that first happens, they're not sure what's going on. So, just that lifting of the arm. CBD doesn't feature quite the same eye symptoms as PSP. They have a lot of visual spatial impairments. So kind of that depth of field, not understanding where they are in space. That's not everyone with CBD, but if they're going to have the oculovisual symptoms, it's going to be kind of in that regard. And then lastly, there is some executive dysfunction that can happen in CBD. And so you'll see below that it's actually the most rare. We actually don't even have a count outside of the United States. That's kind of how rare the diagnosis is. And we are currently estimating that 2,000 to 3,000 people in the US have CBD. And then lastly is MSA, which is multiple system atrophy. And that is actually the most similar to Parkinson's. These two, PSP and CBD, are actually from a different protein in Parkinson's in the brain called tau. And then MSA is from the same protein in the brain that causes Parkinson's, which is called alpha-synuclein. Oh, I'm seeing Deborah asked about executive dysfunction. Thank you for saying that. So executive dysfunction is kind of challenges with things like daily planning or I think organization. And so, looking at a calendar, we're for the most part able to say, okay, at 11 o'clock, I have this, tomorrow at 3, I have this. And so executive dysfunction is kind of a difficulties with seeing that and kind of planning out your day, planning out meals or like the steps needed to do something. So I'm cooking spaghetti. Like, do I boil the water first? Do I put the spaghetti in the pot first? And so kind of struggling with those rather than memory or speech or something like that. So yes, sorry, back to MSA, where there sometimes it's executive dysfunction. It's more similar to Parkinson's disease. So it's a little bit tougher to even diagnose as different than PD. The only differences really between PD and MSA are severe balance issues. So once again, balance issues happen much earlier and more severe. And then the autonomic dysfunction part of it is really prominent in MSA. So you'll have early and more intense blood pressure issues like orthostatic hypotension. You'll have more urinary incontinence and issues with that, REM, behavioral sleep disorder, sexual dysfunction. That's going to be a lot earlier and more intense than in Parkinson's. And so you'll see here that it's a little bit less common than PSP, with 2 to 5 people per 100,000 having that. And I also want to give a shout out to our partner organization, Mission MSA. They handle and work with people with MSA. We've been working pretty closely with them. And if you know of anyone with MSA or want to reach out to them, they're a great organization as well that we work with. Oh, I did see I missed a question. Apologies in the chat. What do I think about using a PD skin test to diagnosis? Unfortunately, I can't speak to the PD skin test. I haven't really worked in the Parkinson's research world in quite a bit, so I'm gonna maybe let somebody else who is more in the Parkinson's world rather than the PSP, CBD, MSA world answer that one. Great question though. Okay, any questions on the 3 diagnoses? Okay, great, sounds good. So earlier I mentioned that there's not quite the same type of care available to people with these diagnoses. There's not a medication that can minimize symptoms in the same way that, carbidopa does. And so what do? I also want to mention that these diseases, like I said, progress faster. And so we have to catch them kind of earlier. And if we don't catch them earlier, then the treatment required is a little bit higher. So it's important to what we call comprehensive care. You'll sometimes hear this as interdisciplinary care because they go within disciplines. So disciplines like physical therapy, occupational therapy, social work, they're working together in interdisciplinary fashion. It's a tough word. So don't be overwhelmed by this. This is just kind of an image I like to use of how, a happy brain is someone who is being taken care of by all of these different specialists. There's so many different symptoms with these diagnoses and with Parkinson's. I think this is very applicable to Parkinson's as well, where it's helpful to have different specialists address different symptoms. So for instance, OTs, home modifications, adding railings, finding a way to make bathrooms safer, working with PTs on fall risk assessment, early wheelchair evaluations, making sure that people with PSP, CBD, or MSA are getting frequent swallowing evaluations because it will progress more quickly. And it's important to get ahead of that and know when to consider feeding tubes if that's of interest. And so we encourage SLPs to work closely with them. And similar with Parkinson's, there are speech changes. And so working with a speech language pathologist to kind of get ahead of those speech changes. There is, of course, speech therapy. In PSP, CBD, and MSA, it's not quite the same strengthening. So, I'm sure you've heard of LSVT loud and LSVT big. They don't have quite the same quality because the speech issues and the vocal cord weakening is a little bit different than in Parkinson's, but it is still an option, and we encourage people to try anything and everything they're interested in. So you also see that we recommend social workers to talk about advanced care planning, which are kind of the legal aspects of care. So, assigning someone to be kind of your spokesperson in the future, signing papers like DNRs, which are do not resuscitate, things like that. Social workers can guide you through those hard conversations. Like I said, ocular symptoms are pretty common in these diagnoses, especially PSP. And so there's a specialist called a neuro-ophthalmologist that we oftentimes recommend that people see. So that's an eye doctor. And the difference between a normal ophthalmologist and a neuro-ophthalmologist is that a neuro-ophthalmologist works with eyes as they relate to the brain rather than eyesight changes like prescription glasses and things like that. So while an ophthalmologist can help people with PSP, we do recommend a neuro-ophthalmologist. A physician, of course, can, try different medications for mood, for blood pressure, and things like that. So we always recommend talking to a general practitioner or their neurologist about different medication options. RNs, of course, nurses are so important in any kind of care. And so we always recommend people, talk with a nurse or a pharmacist. This is not the exhaustive list, but we definitely like to give this list to people. I'm seeing a good question in the chat. It says, is comprehensive care possible to set up outside of a university setting? I love this question. Thank you for asking. I couldn't have said it better myself. Most people don't have access to this kind of care in one setting. As Martha said, a lot of universities and our centers of care, which I'll talk about later, do provide this in a comprehensive way, but that's not the norm. And kind of the way I like to think of it is you're kind of piecemealing it together. It's a lot of work. I'm not going to underplay that, but it is possible to find each of these specialists in your community by asking your doctors, by asking your PT, by asking your OT, and kind of like cobbling this kind of comprehensive care together. Something I also like to tell people, and only recently realized myself, is that you can ask your doctors if they will talk to your other doctors. They might not always say yes, and they might say, that's out of my system, I can't do that. But sometimes you'll be surprised that they'll be willing to hop on a Zoom for 5 to 10 minutes, hop on a call, send notes to each other. And so kind of asking, hey, what can you do to help me create this comprehensive care is allowed. They're your doctors, they're your appointments, and you're allowed to advocate for yourself. And in this case, the worst case scenario is they say, sorry, we can't do that. The rules won't allow that, but sometimes there's a pleasant surprise in that by asking for that kind of care. So I can talk more about that later if there's any more specific questions, but the norm is not that this is given in one setting. And so there is a lot of work put into it, but you can find a way to have the full circle of care not under one roof. Okay. So before I get into Cure PSP resources and programs, do we have other questions about the diseases overall?
There was another question in the chat as
Oh,
well.
sorry, I missed it.
That's okay.
Oh, above. Okay.
Yep.
Oh, I see it. Okay, Mary, thank you. I apologize for missing that. Mary said that her husband was diagnosed in 1998, but has had symptoms since his early 30s. He's 69 now. How long has these? How long has these three been talked about in the medical arena? These diagnoses. So Mary's question was, how long have these three diagnoses been talked about in the medical world, I believe. PSP has been discovered and kind of worked with much longer than CBD and MSA. I don't have really a specific timeline. So Dr. Larry Gulby, I'm going to get a little bit too in this. I'm sorry if this is in the weeds, but he is on our scientific advisory board, and he created our best practices guideline back in the 90s. And so I would say about the 90s is when this started to be talked about. And that was PSP. CBD and MSA came a little bit later. And so it's only now that I think they're becoming more commonplace. My colleagues will tell me that it has felt like a lot of growth to go to professional conferences where there's neurologists and healthcare professionals, and they now can say, oh, PSP, progressive supranuclear palsy. And the neurologist says, oh, yes, I've seen a patient, I've heard of that. Whereas 15 years ago, that wasn't the case. And it was like, PSP, what's that? I've never heard of that. So just work on advocacy and people getting diagnosed more and going around and telling their practitioners, hey, this is kind of the situation. I was diagnosed with this. This is what this is. That has been a huge change to the knowledge and understanding of the diagnosis. I'm looking at the next question, which was the last symptom of PD on your chart. I didn't have PD, I don't think, unless I'm forgetting it, but happy to answer other specific questions. I'll let it stay here for a second in case that was what you're referring to. Okay, great. I think I covered those, yeah. Okay, any other questions? And I'm also happy to answer more at the end, so don't feel like you have to ask them now. Okay, great. Oh, RBD, thank you, apologies, is REM behavioral sleep disorder. So that's when people are acting out their dreams in their sleep. While they're in REM, their body isn't shutting down the desire for movement. And so, people are punching, people are kicking, and sometimes that can be dangerous to the bed partner if they share a bed with someone. And so that's something that some medications can help with, and you can ask your neurologist about that. Martha asked if diagnosis is based on symptom and treatment responses to carbidopa. Yes. So that is probably what I anecdotally hear is the most common flag that people's neurologists say, hey, maybe this isn't Parkinson's, because they come back and they say, I tried the carbidopa and my support group members say that it helps them, but it's just really not doing anything for me. And so that's when a neurologist might be like, that's strange. Let's look into this. And so that's kind of when they start to investigate other symptoms, kind of watch the progression, maybe send them for some other tests. There's no biomarkers, which means there's no obvious sign that there is PSP, CBD, or MSA, but there are some indications. So something that I'm going to skip ahead of my presentation to show you something quickly. So you'll see this middle book right here with the hummingbird are PSP Some Answers. The hummingbird is there actually because in the brain, for some people with PSP, they have the hummingbird sign. I wish I had a photo of it, but sometimes there's atrophy, which is the brain kind of breaking down in certain spots that looks like a hummingbird. And so there are tests that can happen like that MRI where maybe it will help them determine what the diagnosis is, but not every single person with PSP will have that hummingbird sign, or maybe it won't be as pronounced. So after maybe someone doesn't respond to the medication, the neurologist will order other tests and whatnot to kind of see further. I also will note that many of you who have Parkinson's diagnosis may have heard of a DAT scan. The DAT scan doesn't quite give as much information on PSP, CBD, and MSA, but it's still worth trying. We recommend anything your neurologist says, follow their instruction, but just a thought I had while I was kind of talking. Okay. Just reading the next question, apologies. Someone's husband has NPH. Can you please, Patricia, spell out what NPH is in the chat for me, please? We do not address help for that, but maybe I can connect you with some folks in the world. Okay, I'm gonna keep going. Once again, feel free to keep sending your questions in the chat and we can answer them, but I'm just gonna move forward for sake of time. So my role at the Parkinson's Foundation, my role at Cure PSP is anything educational. So that covers our educational resources, of course, which can look like digital booklets, it can look like our webinars, it can look like our in-person programs, and also our programmatic efforts. So we'll dive right into those. So an example of our educational resources is that we have them all available digitally and most of them available physically. So something I really like is that when someone emails us or calls us, they say I was newly diagnosed, what on earth am I supposed to do? We can send them a packet. So we have these 2 packets that you can request. You could go in right now and request them. And they have just kind of a general overview. It's not all of our information because it can be a lot to read at once, as I'm sure you've all experienced with a Parkinson's diagnosis. Too much information at once, not for everyone, is a good thing. For everyone is not, you know what I mean? So yes, so we have these packets, one for patients and families, which are just kind of the what is the diagnosis, what next, and the healthcare professional information packets. I am very passionate about healthcare professional education on these diagnoses, and so I love sending these. They are copies of various resources that can be used to be passed to healthcare teams. So maybe a neurologist heard about this. They can order themselves a healthcare packet, pass it out to their staff, and make sure that people are aware of these. So to break down some of the resources, these are our most popular resources. I mentioned these earlier, and we have our Some Answers booklet that pertains to each of the diagnosis. It's an FAQ format, so it's a lot like, what is this? What does it mean? What is symptom management? What is this symptom? And they're really, I think they're maybe like 10 pages, this 6 by something, and they're about this big. So like I said, you can go online, download them, you can order them. You can order them to someone else. Really, it's up to you, but those are accessible to you physically and digitally. So back to the healthcare professional education, we have and support healthcare professional education through other partners. And so for instance, you'll see this top one, it's rehabilitation implications of atypical Parkinsonisms. I've gotten much better at saying that, but the first time I had to say that, it was a mess. That is with what's called the Shirley Ryan Ability Lab, which, if you haven't heard of that, is a fantastic organization in Chicago. And they are rehabilitation therapists, which are physical therapists, occupational therapists, and speech language pathologists. And they specialize in helping people with movement disorders and all other sorts of things like stroke, traumatic brain injury, but they really are fantastic and specialized in some areas, including Parkinson's and atypical Parkinsonisms. And so they graciously agreed to host a specific atypical Parkinsonism webinar last summer to educate people on the differences between that and Parkinson's. And we will continue that actually in the coming summer. We'll get more specific into the different rehab professions, which again are physical therapy, occupational therapy, and speech language pathology. So secondly, and the next two you'll see here, the Atypical Parkinsonism podcast series and the online course were done in conjunction with the Parkinson's Foundation. So they were also very gracious to do an entire online course about helping people with atypical Parkinsonism. These two were actually kind of prerequisites or pre-work for an in-person course that we had with them. It's for their advanced team training is what it's called. And they invite healthcare professional teams from around the country to join them for an in-person training. And that one was focused on atypical Parkinsonism. So we're super grateful for these, kind of larger organizations helping us to spread the word about these diagnoses. The generosity is just astounding to me and really grateful for that. And then lastly, I flagged this for you all earlier with the computer logo that you saw on the screen. This is also where you can find that guide you can send if you are feeling concerned or just want to, spread awareness of these diagnoses to your doctors. So moving on to some programs that we have coming up. Anyone is welcome to join these. You don't have to have a diagnosis. I also want to flag that in the same way a lot of the Parkinson's information resources are helpful for people with PSP, CBD, and MSA, I would say a lot of the resources available for these diagnoses are also helpful for Parkinson's. So in this CARE conference, which is coming up Wednesday, November 19th and Thursday, November 20th, we will cover concepts that I think can be helpful for any diagnoses. For example, we have a panel on the role changes and familial dynamics in these diagnoses. So we'll have a social worker talk to people who have different connections to the diagnoses, and they talk about just the way that their lives changed and the way they adapted. We have a spouse, we have an adult child, and we also have a person with a diagnosis. And so they'll talk about how their lives changed and how they adapt. In addition, we have things like the advanced care planning that I mentioned, which is advice on prepping for the future. Like I said earlier, it can be a hard conversation to have, but can really give you and your loved ones peace of mind. And so we'll cover things like that, not just symptomatic on the specific diagnoses. So if you're interested in checking that out, or at the very least, go ahead and check out the agenda and see if it's something that'll be interesting to you. We will have it on YouTube by session. So if in the future you just want to go check that out, please feel free to do so. We invite anybody. We also have what we call our PSP, CBD, and MSA 101. It's 3 days, 1 hour per day, so 3 hours total. Our next one is on November 17th, 18th, and 19th. So it does overlap with the CARE conference, which is we didn't really mean to do, but it is what it is. And this is just a time to, one, better understand your diagnosis, but two, connect with other people who are newly diagnosed, and then three, learn about how CARE PSP can support them. We consider anybody that's diagnosed relatively a year-ish to be newly diagnosed. We're not particular. And so this can be for anyone who is maybe going to be diagnosed or has a definitive diagnosis. We don't have any hard cutoffs. And so I saw some folks in the chat say maybe that could be applicable to them. And we completely invite you to join this if that's a possibility for you. We also host what we call Ask the Experts. I believe 4 times a year we have English ones and 2 times a year we have Spanish ones. The last one of 2025 will be on December 9th. And this one actually is pretty applicable to Parkinson's as well. We're talking about expanding access to care. And so what this looks like is these two folks here, they're from our centers of care. Dr. Z and Dr. Bruno do a lot of research in Parkinson's and PSP, CBD, and MSA access to care, which in this case means care outside of the populations we currently treat. And so kind of finding, the lesser known populations and care in non-white populations, which is where Parkinson's and PSP and CBD MSA are mostly diagnosed. So really trying to make sure that people across the board, across the world are, being diagnosed appropriately and treated appropriately. So happy to have anyone join us. One of my favorite things at Cure PSP, and this is applicable just for PSP, CBD, or MSA, is that we have this grant that covers 100 hours of professional in-home care. Because these diagnoses progress so quickly, and because the symptoms become more severe so quickly, in-home care is something that for many people becomes a necessity. But as I'm sure you all are aware, in-home care is expensive. And despite the fact that it might be a necessity, some people can't access that, which makes total sense. It's so expensive. And is more of a luxury than a necessity. And so we provide up to 100 hours of professional in-home care per person who receives this grant. And so you can see the eligibility of that down here. It does require a diagnostic confirmation from your doctor. So just keep that in mind. We also have 15 support groups within Cure PSP's umbrella. Actually, excuse me, I think it's 20 now. We also have an entire list of regional support groups, which is when someone emails us and says, hey, I'm in Toronto. I host a support group in my area. Will you list it on your website? This calendar you're seeing right now is all of the Cure PSP sanctioned support groups. They're very specific, as you'll see. You can kind of see a teaser of a care partner group. We have a bereavement group. We have a men care partners group, women's care partner group. So we really have kind of a really specific array. And so we also do just have general people with PSP, CBD, MSA groups. So if that's applicable to you, feel free to go take a look. We also have chair yoga once a month on Fridays, which highly encourage you to check out if that's of interest. It's just like a nice reprieve from the middle of the day. And we have that by someone who's a yoga instructor whose dad actually has PSP. So she has a really lovely personal connection to it, and that family is just really generous. Yes, they are virtual. Thank you, Brenna. These are all virtual. And you can join as many as you'd like. We have some people who join 2 different groups a month, 2 different groups a week, all available to you, no limits. And I will answer the other questions. I just happened to see that one other corner of my eye. I believe this is my second to last slide. I also want to give a shout out to our centers of care. We have 38 and growing. We're currently in the US and Canada and hoping to expand in the next few years. What these are is they are centers who have been designated to provide quality care, comprehensive care, which again is that big circle of different types of care. And they also do research at these institutions. So we recommend oftentimes that people check them out if there's one in their area. A lot of people will travel for an initial diagnosis and then kind of work out referrals. We do really trust these people. And so if you are considering a diagnosis or know someone who's asking about this, this is a great place to point them to. And we're really happy that there's the support, and we're always trying to cover the gaps in areas. As you'll see, the middle of the states is kind of our current project, is trying to make sure we have care in those areas. Oh, I had 2 more, I'm sorry. Okay, so like I said, we also have a research arm. And what that looks like for us is we have a brain donation assistance program. Well, we don't do the actual brain donation. We have a direct contact to the Mayo Clinic Brain Bank. And then what we can do is reimburse up to $1,000 in that cost. So that's really helpful just financially, but also, like I said, we have that connection to the Mayo Clinic who will take care of the whole process with you. Secondly, we have our Cure PSP genetics program, which is a blood sample donation to help find if there's any genetic cause to PSP, CBD, or MSA. And then lastly, we are conducting a survey. So you'll see it's on a SurveyMonkey link, trying to evaluate the financial cost of having PSP, CBD, or MSA. So that's going in and really doing some numbers for us, which is a really generous gift. Time is not super free when you're caring for someone with these diagnoses or have it yourself. But that's just trying to help inform us of how Cure PSP can use funds and grants and such to help people with these diagnoses. Okay, there you go. So these slides will be shared with you. So you'll have all these links. You also have my information, and then you'll see these last 2, the info email and the phone number, go to me and my colleague. So really feel free to just email me directly, or I will also see these too. But either way, feel free to ask any questions or concerns. I'll try to point you to the right resources. If I can't answer your question, I'll find someone who can. But we are an open line to you, and we hope that we can, figure something out if you have questions. So I'm gonna look at the question I missed in the chat, and feel free to keep submitting them. Okay, somebody said, my wife with PSP seems to be more easily distracted. Is this a subject of impulsivity? So Robert, this can be a symptom of PSP, and that's kind of what I was saying about the executive dysfunction, kind of being able to, typically would hone in on something and do it from A to B. So, eating a meal, kind of keeping that mental task on eating, and can kind of be like, oh, like the brain just kind of, I don't want to say like floats is kind of the word that comes to mind, but I don't know if that makes sense clinically. Don't repeat that clinically. But yes, that can be a sign of PSP, but more the executive dysfunction rather than impulsivity. But they're hard to differentiate. And your neurologist can always recommend kind of maybe some treatments or a direction to go in for that. And we ended 15 minutes, so we have 15 more minutes, I think, with questions, but Jillian, you can correct me if I'm wrong with that.
Yeah, feel free if just you can unmute yourself if you have any questions or type them into the chat. That was a great presentation. I learned a lot. So
Happy
thank
to,
you.
yeah, of course. And if you think of questions later, you can always email me. No pressure to do it right now.
Awesome. Well, great. Thank you so much, everybody, for joining us today. Thank you, Courtney, for this amazing presentation. Like Courtney said, she will send the slides and then I will send them out to everybody. I will also be posting this up on our YouTube channel, so you can always go back and watch it again if you have questions. I do know we do have I think one of the centers at UNC Chapel Hill in
Hmm.
North
Yes.
Carolina, and then I think there's one maybe at MUSC in
Hmm.
Charleston. I'm not, so we do have a couple of those in the
Great.
Carolinas. So we're definitely lucky to have them reasonably close to us, depending on where you are. Um, but I'll also put out some other links of the website and other things as well, so people can easily access that.
Thanks for having me. It was lovely chatting with you all, and reach out anytime.
Thank you so much. I hope everybody has a great day today. Bye.